Chapter 19, Illness and Hospitalization. Every individual has their own personal concept of health based on their values, their lifestyle, and their personality. Each individual's state of health constantly changes because we need to respond and adapt to changes within our lives. Illness is an actual abnormal process where aspects of social, physical, emotional, or intellectual condition, as well as the function of an individual, are impaired or diminished compared with that individual's prior condition. Being ill has various stages during the experience. The first stage is the symptom experience. An individual will often be aware that something is wrong. What they try to do is control the symptoms. This is when they might use over-the-counter vitamins and herbs and supplements, and they try to take care of themselves. Then the next stage of illness is where someone will actually become part of the sick role. They give up their normal daily role and they seek support while they're in the sick role. Then next stage is medical care contact. This is where individuals will seek professional advice and they actually seek approval from someone with authority that allows them to be in the sick role, and they determine the treatments and the procedures. The next role is the dependent patient role. This is where the patient will actually accept the health care and they will receive an actual treatment and follow a specific program. The last stage of the illness is recovery and rehabilitation. This is where the individual will leave the sick role and go back to their normal roles and responsibilities. When one experiences illness, there are many factors in the first stage that determine the behavior. Nature of the symptoms, individual's knowledge, availability of treatments, emotional responses during this stage will help determine what a patient will or will not do. When they assume the sick role, the patient is first excused from their everyday responsibilities, and other individuals will pick up and do tasks that they were supposed to do. During the second phase of stage 2, permission is provided for the individual to rest, conserve energy for healing. In the third part of stage 2, the individual will interact with others so they can just restore their health. Stage 3, the individual will either accept or reject a diagnosis. If they reject it, they will continue to deny the problem. Stage 4 is a dependency stage. This is when the ill individual will accept other people's care that they're making, and the dependent role is assumed for the individual that is experiencing the illness. In stage 5, the individual will actually go into the recovery and rehabilitation stage. This can occur suddenly, or it can be slow depending on the actual illness or disorder. If recovery is quick, the individual will gradually give up the illness role and then go back to their everyday routine. A short-term acute illness would be like the cold or the flu. These don't affect an individual's behavior a lot. But if it's something that is serious, whether it's physical or mental, This can lead to dramatic changes for everyone that is involved. Depending on the individual, they can react to their illness and have anxiety or any of the stages of grief, whether it is anxiety, anger, denial, shock, or withdrawal. When we look at the behavioral and the functional status associated with grief, consider anxiety. This is related to stress, feelings of apprehension, and the uncertainty of the illness. Anger is a feeling of mistreatment or being opposed. It can be either going inward toward the individual or outward toward other individuals. It may affect an individual's functioning socially. When it's denial, they're just refusing to accept information and facts about their illness. When it is shock, that's an overwhelming emotional state, and the individual is probably unable to process information that is around them. When the individual withdraws, it is removing the self from others in their society or their social group. It often could be considered a sign of depression. Denial is a defensive mechanism that is used to escape from painful feelings that are triggered by problems that are going on in one's life. Sometimes it's helpful because it allows the individual to gather their thoughts and reorganize. But if the denial actually clouds judgment and prevents an individual from taking steps to restore health, then it is dangerous for the individual. Hospitalization is actual placing of a person that is either ill or injured into an inpatient facility that will provide 24-hour nursing care as well as medical staff. Every hospitalized individual have one thing in common. That is the feeling of not being in control and being dependent on the mercy and knowledge as well as any expert experience of the healthcare providers. Being in a hospital can become anxiety-provoking when the admission process transforms the person from an individual into a patient or a client role. There will be a name band put around the wrist that provides a means of identity, and now the nurse or the doctor can identify the individual by that band. The demand for actual paperwork that has to be accomplished related to an illness diminishes the individual into an account number and eliminates whatever energy they currently have. When the individual gets a gown from the institution, this actually helps the individual exchange their role from one of being productive in society as a functioning adult to that of a patient. So the first stage of hospitalization is being overwhelmed. Individuals are apart from family and friends. They're in an unfamiliar environment, and they don't feel they have any control over their environment. They need to cope with what the illness is presenting to them. Plus, they also need to control their anxiety related to their experience they're going through. In the second stage, the patient or the individual will gain strength and reestablish some of their own personal identity. Oftentimes, individuals will become very self-centered during this second stage of stabilization. During adaptation, which is the third stage, individual or the patient has regained enough of their actual control of their self or their personal identity that they're able to adapt to the situation. They will become interested in what's going on with themselves, and they will learn about their actual problems and develop techniques. During this time, they are able to replenish or regain some of their energy. Depending on how an individual reacts to a threat or a crisis, this will determine how the individual responds to the actual stress of just the hospitalization itself. So a patient that is in a situation that is filled with unfamiliarity, uncertainty, they don't know when they'll be able to leave or what the diagnosis will be, they're very apprehensive. If individuals are aware and alert, they may fear others' behaviors, and finding odd or inappropriate behaviors can create a feeling of need for protection as well as create anxiety. Therapeutic care interventions, this actually communicates a willingness or participation in the focus of their attention on the client. It provides an opportunity for interaction, and it also allows the nurse to assess how well the individual is adapting to changes that are coming about from the treatment. The nurse will look at the individual, the client, as well as the family, and determine how well they are perceiving what's happening in the current environment, as well as how they have dealt with stressors in the past. The nurse needs to provide appropriate referrals to social services as well as community resources once the stress and the patient has or the client has been discharged. An individual's family is a very important factor in their life. Oftentimes, families have a significant impact on the outcome of an individual's illness. Pain is very subjective in nature because no one can see it, feel it, touch it, or sense it like the individual or the client can. People will actually view their pain based on past experiences, their level of anxiety, their attitude. What one person can barely tolerate, another person may say it is mild or moderate. As a nurse, we need to make sure that we are setting realistic goals for pain management with the patient as well as their family. We want to make sure that we assess the patient's pain often, and we need to make sure that any education and assessment tools that are being used are age appropriate. We want to educate the individual so they understand non-pharmaceutical methods to manage their pain. So for a nurse, we need to make sure we have early identification and intervention for individuals so we can help them cope with their illness or dysfunction whenever they are hospitalized. Changes may need to be made in daily routines or to their home whenever they are discharged. We may need to institute a new therapy, install maybe handrails or a seat in the shower, eliminate throw rugs. Just depends on whatever the patient needs upon discharge.